So welcome everyone to the Science of Pandemic Tech Series. So a quick introduction for those who haven't been here before, that this is an event co-sponsored by Luca Ferretti, representing a big data institute at the University of Oxford, and me, Joanna Masel. And what we're trying to do is present science defined extraordinarily broadly, as rapidly as possible, to the people in tech or in public health who can put that into action. And so we, today is more of a tech event than a pure science event, but basically new ideas, get them out there, get them discussed, get them accessible, and get them actionable as fast as possible, with no particular respect for disciplinary boundaries and all being in conversation across the tech, science, and public health sectors. As part of that, actually both Luca and I have our backgrounds in evolutionary biology, neither tech nor pandemics, but we're working on this now. My day job is as a professor in evolutionary biology, but now I am here running this with WeHealth. And today's event is on strategies for presence tracing. And what many of our audience is very familiar with is proximity tracing. Were you in close contact? Which in the US is 6 feet. If you listen to the WHO, it's 1 meter. If you listen to the Swiss, it's 1.5 meters. If you look at some other places, it's 2 meters. Whatever it is you choose, are you within some arbitrary distance threshold of a person who was infectious for COVID? And then if so, there's all these rules that you should follow after that. The problem is these rules were all set based on a outmoded idea of droplet transmission, and that droplets travel a certain distance before dropping, and if you're further than that apart, you're safe. And what we know is that aerosols come in a range of sizes and stay airborne for a range of durations, and that you can certainly get infected when you're less than 6 feet apart. And indeed, the secondary attack rate can be pretty high if you're in an enclosed indoor space with a highly infectious person with insufficient ventilation, even if you remained at the other side of the room for them at all times. And there's plenty of examples where of super spreading events where there is no correlation whatsoever between distance and infection within the enclosed space. So the interest is in tracing those who were not necessarily in proximity, but who were present at the same venue. And the panel we've put together today have an amazing variety of ways of accomplishing this, so that it was actually hard to put together a slide of what they all have in common. But what's in common in all cases is the visit is somehow recorded. It might be a QR code like in this image, or it might be NFC, or it might be over Bluetooth. There are all kinds of ways of recording it. It could be recorded only in a privacy-preserving manner on the phone, or it could be shared with contact tracers. It could be in some centralized database. It could be uploaded in different circumstances. But one way or another, the visit is recorded. When a site becomes of concern, it is broadcast. That could require manual action by venue owners, by contact tracers, by individuals, or it could be a highly automated process. But again, all the variations, the site is somehow broadcast and the individuals who were there are somehow notified. So that's what is in common. And what I really want to highlight in the panel is the diversity of ways of getting there. I guess you have to check our website for some of the details for the speakers, because I'm running out of time. But Merrin MacLeod will be talking about New Zealand, who I believe was the first to implement such a system before they implemented proximity tracing. So she'll be kicking off, as is due course, given the pioneering role New Zealand played in all this. Vincent Roca will talk about the French system. I think many of our audience are more familiar with solutions that are compatible with the Google Apple exposure notification protocol. France is outside that, so they can do things a bit differently, and it'll be really cool to hear about how the French app works. And then we have Ed Bugnion, representing Switzerland. Switzerland has been a pioneer in and driver of the most privacy preserving aspects of these protocols. And they have a different system to you. We have a number of Google, Apple exposure notification compatible systems, but they have a particular take that emphasizes aspects of privacy. Justus Benzler will tell us about how things have been implemented in a highly automated fashion in the German Google Apple compatible Corona-Warn-App. And he spoke, and thank you, Justus, for coming back, you know, having previously spoken at these events. And James Petrie, finally, from WeHealth, who may be the youngest member of our panel, but he had the good foresight to start working on his PhD thesis in December 2019 on pandemic preparedness. And his was actually the first privacy preserving decentralized Bluetooth protocol to be published, because he basically already had it on GitHub, I think, in February 2020, and published in March. And that was the TCN protocol, which is not totally dissimilar to the Google Apple, but has a lot of other aspects. And some of those other aspects can really come to the fore when dealing with alternatives that involve presence tracing. So finally, before I kick off, I'm just going to sort of say what our next event is going to be rather different. It's going to be about why we trace rather than how we trace, and about early treatment and prophylactic treatment and so on. So that's the next event. But I will leave it at that. And Merrin, you're up.
Thank you, Joanna. Is that working? Cool. So I'm Merrin MacLeod. I'm the product lead on the COVID Tracer app at the Ministry of Health in New Zealand. I'm going to aim to keep things pretty high level and limited to public information, because I am from the government here. So if anything that I say contradicts official policy, it's me who's wrong. And I'll also take sole responsibility for the quality of my slides. I did them in Microsoft Paint, and that will be apparent to you. So this is New Zealand. We are, some people say that we're a small island nation, and that's not true. We're a medium-sized archipelago nation. We're in the southern hemisphere, so we're just coming into spring. And we've had a bit of a different journey over the pandemic, and we've had some different choices available to us than I think a lot of the people in Europe or in the States. So the strategy that we have for dealing with COVID-19 is an elimination strategy. So for the most of the last 18 months, we've had no community transmission of COVID-19. And where there have been outbreaks, we've pulled out all the stops to stop them. Vaccines have been later than they have been in other countries, but we're catching up. They only became available for the general population at the beginning of September. So we really are, sort of catching up now. So during the periods where there's no known community transmission, there's been a very low level of restrictions that increase quickly when there is an outbreak. Unfortunately, we are currently experiencing an outbreak. So it's likely that at the moment we do currently have some restrictions in place. We communicate these restrictions through a 4-level alert level system. The lowest level of restrictions, this was the quickest way that I could kind of communicate this. So the part of the time of the last 18 months, been at level 1, the lowest level of restrictions, where you can have raves. And then part of the time we've been at the highest level of restriction where you can't have KFC, there's no takeaways. And I suspect that most people have been in sort of that middle area for most of the time over the last 18 months. We've been sort of more at these extreme ends. And so I'm here talking about our app, which supplements the thorough manual contact tracing process by helping people to keep track of where they've been at all alert levels. It also has EN, but it's completely separate, and I'm not going to talk about it too much today. The system, as I'm describing it now, has mostly been in place since May 2020. We added exposure notifications, the Apple exposure notifications protocol in December. So at all alert levels, businesses need to display a government QR code poster. These are based on the pre-existing New Zealand business number register, but anyone can sign up for one. Pen and paper record keeping is also in place. Businesses are encouraged to create ballot boxes to do this in a privacy preserving way so that people can't come in and take photos of the paper registers. The call to action for New Zealanders is to keep track of where they've been, even if there's no known current community transmission. And the easiest way to do this, to keep track of where you've been, is with the NZ COVID Tracer app. When you scan a QR code or add an entry manually, it's added to your on-device diary, which is visible to the user. If you test positive for COVID, you'll have the option to upload the entries in your diary to the contact tracing system, and this will inform a discussion with contact tracers. Contact tracers are able to broadcast locations of interest, that is, places and times where people have been exposed to COVID. Each person's phone checks against these times and places, and if they had a diary entry for that time and that place, they're notified. I'll note that there's no automatic link between these last two steps. Locations of interest are generally only broadcast if there were unidentified people there, and people scan into places that may not fit that criteria. We can also look up the poster details and broadcast these locations even if the case didn't scan in there. I'll give a quick rundown of the clinically led contact tracing process that this is designed to augment. So in New Zealand, everyone who tests positive for COVID-19 is notified personally, generally over a phone call. Most of them go to hotel quarantine where food's provided and there's medical care on site. Close contacts are required to self-isolate. They're followed up over the phone several times during their isolation, and they must get tested, usually 2 or 3 times. Delta means that a lot of people are considered close contacts. So sometimes everyone who is at a location of interest is considered a close contact. Something else to point out with the New Zealand context that's a bit different is that genomic sequencing is carried out for every single case. For every single person who has the virus, we expect to know where they got it. And we can find it out both with case investigation, contact tracing, and with genomic sequencing. So if a case has a COVID genome that's very similar to another case, we generally know where it's come from, but we still want to find that epidemiological link to know how they got it, so we can trace down anyone else who got it in the same place. If it's very different from anything else we've seen, we know that there's been missing links and that the spread is bigger than what we currently understand. So the aim with contact tracing is for people who've been exposed to isolate as quickly as possible so that they can't spread it any further if they have contracted the virus. There's a number of ways in which this happens. First of all, the case shares details for people they know they've been in contact with: household contacts, social contacts, workplace contacts. And these people are called up by contact tracers. The case also shares details for the places they've been while they were infectious. Uploading their diary from the app helps, but it's not the only way that that happens. If they're not an app user, they can go through their bank history, that kind of thing. The places where exposures occurred are informed and visitor and workplace registers are sought. Contact tracers can then notify staff and visitors who are identified through those registers. If that location was a public place and those registers don't capture everyone who was there, we publish the details of that time and place on the Ministry of Health website. People check that list and often they'll self-identify that they were there by reading it. And the same details as the list with the unique ID of the poster are then published to an API that the app checks so that people who scanned in to that place at that time receive a notification. So each device checks their diary against this list and alerts the user if they have a matching entry. This alerts them, but it doesn't give their details to contact tracers for follow-up. They need to self-identify. Generally, the system works pretty well. It has reasonable buy-in from our clinical teams and it has pretty good trust from users. It's been in operation for over a year and it's always being improved. I think one of the reasons that it works well is that the mental model is fairly simple to understand. If you get an alert, you know why. you know whether it's accurate, and you can pass it on to other people who are there. You can tell contact tracers the information that they need to know to manage you. And if you do end up testing positive, they'll have a pretty good starting point for working out why. The diary being visible to users is also important for that clarity. If notifications aren't sent, you can still check against them. If you've got to scan in somewhere, you can backfill it later. However, the assumption inherent in the model is that each device is unique to one person and that each person has a device, and this simply isn't true. Some people share a phone, some people don't have a phone, and some phones can't run the app. The diary only being stored locally is also very fragile. If you drop your phone in the toilet, your effort of scanning has been wasted. People assume that it's backed up or tied to a login because that's how most things work, but it isn't. And that's me. That's
Great.
Thank you.
And we will take questions at the end. So Vincent, Roca, that you would be next.
Yes, thank you. Sharing the presentation, switching to full screen. Okay, can you see the slides? Okay for you? Yes?
Yes.
Okay, perfect. So hello everybody. So thank you for the invitation, Joanna, and welcome to everybody. So I want to talk about the French two-scientific app, and more specifically our clear presence tracing protocol. It will be a very high overview. I won't go into details, but I will leave this for the discussions. Otherwise, roughly speaking, this is more or less the same as what has just been presented with scan QR codes when entering a location, and then with an automatic systems. Before focusing on CLEAR, I would like to start with a bit of context, because I think this is essential in our case. Back in April 2020, because of some events I won't focus on, we in France decided to have a sovereign app that is totally independent from the on-the-shelf Google Apple solution. So, as you most probably pretty know all. So with this two-scientific app, we claim to have found a balanced compromise to the benefit of public interest. And I insist on the fact that this aspect is very important. We have the choices in our hands, and the hands of our public health authority, and the hands of our democratically elected government, not in the end of private companies, and it was something very important for us. So for sure, and we have always been clear on this, this is not the universal solution as it requires, as we make three assumptions, key assumptions. First of all, it's exceptional. Then we have these trustworthy institutions. And we also rely on DPA that conducts regular on-site audits of the whole system to make sure that everything is fine. So let's continue. The result is this app, which has been entirely built from scratch. That gathers many different services, as you can see on this slide. Contact tracing, presence tracing, but also those digital COVID certificates, and also something that was very practical for many people, the generation of attestation during the curfews and the lockdowns. But also we use this app to convey information on the pandemic statistics, very detailed statistics, and general news. So none of these services for sure are sufficient to, but they do complement one another pretty well. And of course, having them all in the same app is, from our point of view, essential because the app is well identified from the general public, and it contains whatever the users may need, even if they don't necessarily use all the features. And we currently have approximately 22 million monthly active users, which makes it a pretty common and popular app. So, sorry. So let's continue. So let me now quickly focus on the clear presence tracing main features. So first of all, we have a centralized identification of COVID-19 clusters that is fully automatized. We perform both forward tracing and backward tracing. So forward tracing to for the question of what locations are at risk if I was there while I was being contagious, and backward tracing is the opposite solution, in which location did I potentially got infected. So we are doing both of them, and all of this automatized, and we send, and this is important because we want to send notifications as fast as possible. So that's for the cluster detection part. Then we have decentralized risk estimation and notification within the smartphone. So it means that unless you are COVID-19 positive, then your visited locations, your diary, will never leave your smartphone, and that's something that users can pretty well understand. And there is necessarily a negative side. So in order to make it possible, we have a public database, a public blacklist of all the cluster location pseudonyms. But in this particular case, and what's not the case for contact tracing, but in this particular case with presence tracing, this is acceptable because this public database, there is no access control, it's very public. This public database does not contain pseudonymized sensitive health data. That's a big difference with respect to GAN. Then CLEA can be used both in a static manner or dynamic manner. It depends on what you want to do, depending on also how location QR codes are generated. Both are possible, and our health authority finally decided to go for a static approach where the QR codes are typically printed and remain the same for a long period of times in a given location. But we also designed a proof of concept with a cool device that can rotate the QR codes, for instance, on a daily basis. So that was validated as well. And that's always the same protocol. CLEA can do both of them. So we designed a single protocol, but in fact, there are many features that are left fully open. There's in particular a key question. Which role should a manual contact tracing team play? Clearly, there is no single answer, and I think that today evening we will see several different approaches from this point of view. There is no clear single answer because it really depends on the health organization, for instance, or for instance, on the current situation within the MCT teams. Are they overloaded or not? Or perhaps also on political reasons. There are good reasons to choose one approach or the other. In our case, from this point of view, CLEA offers 3 options from situations where the MCT team is at the center of the deployment, and during interview, this manual contact tracing team can validate or not whether a scan QR code should be passed to the CLEA server for cluster detection because of, well, depending on how it whether masks were used or not, well, that kind of considerations that will be quickly identified by the MCT team. At the also extreme, that's the third option, and this is what it shows in France. There is no involvement at all from the MCT team by default, which means that the CLEA systems will work in a totally separate and autonomous manner. But of course, if during an interview an MCT team believes that there is a specific cluster location in one place, they can go to the location and recover the QR code and artificially trigger an alert. This is something that has been done in some part of France, but not throughout France. And there is a solution in between that I won't detail here, but where there is still this MCT involvement, but not as a first step. In a secondary manner. So to summarize and to conclude, with CLEA, we have a protocol that offers a lot of flexibility and I think addresses most potential needs. Privacy is for sure a key aspect, but it is not the only one, and having a single app from this point of view well identified by the general public is in practice, in our opinion, the best approach, all things considered. And this is where also the DPA comes into action, the Data Protection Authority. We are in France very lucky to have an independent DPA since 1978, so more than 40 years ago. And involving them since the beginning was, from our point of view, really essential. They are specialists, they are independent, they serve the public interest. So we did our best to get them involved in this protocol development, but also in the previous ones. And finally, CLEA is deployed since beginning of June, and for instance, 2 weeks ago, there were approximately 130,000 notifications triggered by this protocol. So that's a lot. Thank you very much, and I will be very happy to answer questions, more technical questions, for instance, during the questions session.
Yes, and meantime, please put your questions in the Q&A, and some of them, at least one of them, has already been answered asynchronously. So just go ahead and keep putting your questions in. So next we have Ed to talk about what has taken place in Switzerland.
Thank you very much. You can hopefully see my screen. First of all, I'm a game day substitution for my colleague, Carmela Troncoso, who unfortunately is under the weather. It's a very minor health issue. She's perfectly fine, and it's not COVID, but she was unable to be with us tonight. So I'm going to try to do my best to represent her. The work that I'm going to talk about is the work we've been working on around a protocol called Crowd Notifier. This is a protocol that is fully specified. It's been published, it's been peer reviewed, it's implemented. The code of it is open sourced, and it is inside the production application use also for proximity tracing, which is called Swiss COVID in Switzerland. Like the New Zealand app and the French app, in fact, there are many, many common points. This is a QR code-based solution. It uses static QR codes, so printed QR codes. There's no dynamic QR codes. The main requirements that we want to ensure is that there was no data that would be collected from users. I think that is universally shared. We also wanted to make sure that there was no data collected about venues and no database of venues. This is actually driven by a number of considerations. One is Switzerland has a very fragmented and regional structure. And so it's actually a lot easier to simply not have a database than to manage database and rights to access to databases. And the other one is we want to make sure that this would be a multimodal application that could scale from very large events down to very private events in which you still want to be able to do presence trace. And we want to make sure that there were a number of anti-abuse properties for large events in which the authority triggers a notification to everybody that was present. And we want to make sure that this could be done in a scalable way. And so we actually have use cases and deployments where we have hundreds of rooms at universities that are managed through sort of a single master key that generates all the different QR codes. Want to make sure that this would be scalable, easy to deploy, and not require any electronic equipment. So in terms of the protocol is relatively straightforward. When you are a user, you enter a venue, you use the camera to take a picture of the QR code that is encrypted on the phone. Everybody does that. If a person ends up being sick, you get an authorization code from the health authority. That health authorization code is entered by the person. The phone that gets recorded. This is actually streamlined along as part of the main Swiss COVID application. A uploads the location in encrypted fashion, the location where he or she was, and that gets broadcast and people can decrypt it. There are two variants of the protocol. The first one is designed to manage multiple rooms, but it's designed to also have a double trigger system so that notification is done explicitly. So the location is actually involved. There's a conversation between the health authority and the restaurant to provide an access code. This provides a way to make an intelligent decision as to whether to notify or not. The privacy of the location of the users is guaranteed through the protocol. And then there is another solution, which is what we call server managed keys, which is a term that we like, that is not the most intuitive one. But basically the idea in this case is to actually have a level of encryption managed through servers that owns a master key, allowing locations to generate their own codes, and the servers can then trigger the notification without going through an independent loop. This provides a faster path to notification, similar to what's been done in France and also in New Zealand. And this is done so that through the public key cryptography that we've implemented, so that The only way in which you can learn about anything is if you actually were at the event that actually generated the code. This is of these two modes, the second mode is fully in production and deployed in Switzerland and authorized and regulated. And the first one is in discussion. The reason I say it's in discussion is because as we were developing and deploying this protocol, there were the law of the land in Switzerland actually required a more centralized data gathering approach in some locations, in particular restaurant. That law of the land still stands. And so for a long time, there was already a class of applications that were doing gathering of information mandated by law. And now we actually have a new legal situation in Switzerland where we need to have COVID pass certificates, so health certificates, to enter these venues, and in return, they no longer have to track identities. And so that is where we are today. And I'm within my 7 minutes. Thank you.
So thank you. And again, use the Q&A function. You can feel free to direct your questions, particularly to individuals as you do that. Justus, let's hear about Germany's solution.
Okay, thank you, Anna, for the invitation. And let me see. I share the right thing here. Okay, so I actually want to talk about a particular aspect of those presence tracing systems and a particular problem that we had in Germany, but that I believe you have in other countries as well. And that's co-presence of different presence tracing systems. So let's look at what we have here. The people involved are the guest, somebody we called an event owner, so who owns the event or the location, the public health authority, and then other guests that have to be warned. And the guests, at least in Germany, they are using one of at least 3 different systems. So one is a paper-based registration, because there are people who are not using smartphones. I think Merrin explained that in the beginning, or they're using smartphones that can't run the appropriate app for it. There needs to be also a paper solution, so a list or a ballot box or something where you put in your contact details when you enter a venue. Then in Germany, we have several private apps that digitalize this process of the paper list. That means you provide your contact details in the app, and then when you check in, those contact details are sent to a database where they are encrypted and from where they can be restored if a need for that is. And then the third solution, that is a solution within our Corona Warn app, which initially was the proximity tracing app, but also is now a presence tracing app. And that is a decentralized system, so where you keep your check-in information on your phone. And if you test positive, then you send that information about the venue and at which time you've been there up to a backend server. And from there, other owners of the app, other users of the app can download it and match with their own records on their phone. Now, because those 3 systems are in place, we have to look at ways to connect them. And for that, let's first check what actually happens with a paper-based registration. So that means the event owner keeps the paper list for some time, and the public health authority identifies a case as a guest as part of the manual contact tracing. Then they would ask the event owner for that paper list of that particular day, if they are kept per day. And then they, in a manual process again, they contact the other guests on that list one by one to inform them about the exposure. In the case of the app-based registration, much of that is similar. So the contact details of the registered guests are kept in an encrypted database for some time again. The public health authority identifies a case as a guest. then they would contact the event owner, and then the public health authority, with the assistance of the event owner, they can decrypt the database. So it needs 2 keys to do that. They need to collaborate on that. And then again, they can contact the other guests that they have in that database to inform them. What happens in the Corona Warn app? That's a little bit different. So the guest keeps the checked-in data in the Corona Warn app for some time. And then if that guest becomes a case, warns the other guests with a Corona Warn app. The connection to the other systems would be through the public health authority. So this first part of the process is without the public health authority. And for the other lists, the public health authority actually then has to ask the event owner for the paper list of that event where the person has been. They need to contact the other guests on that paper list, and they also need to decrypt the database of that event with assistance of the event owner and contact the people that are on that list. So that shows already that there's quite a effort involved by the public health authority for in that case when we have different systems used for that same event. And it's similar for the paper-based registration. So up here you have again the steps that are within the system. Connection to the other systems would be that the public health authority also needs to decrypt the database with assistance of the event owner and contact the guests there. But how about the Corona Warn app? That's the open question here. And if we look at the app-based registration, again, we have the steps within the system, and across systems, it just means that the public health authority needs to ask the event owner also for the paper list and contact the other guests on the paper list. And again, a solution for the Corona Warn app users is needed here. So the solutions that we implemented to cope with that multi-system problem is that we have added a public health authority initiated warning in the Corona Warn app. The requirements for that are that you have the QR code of the event, that you have the relevant information about the cases present at that event, particularly the time span, that you have an authorization for doing that warning, and that you have a Corona Warn app installed on your phone. Then this process can be done either by the public health authority themselves, or they can delegate it to the owner of the event. The process is that you go to that dedicated functional area within the Corona Warn app, that you register the event by scanning the QR code, that you enter the presence details of the person on behalf of which you are going to warn the others. Then you call a hotline for a TAN, and only pre-registered public health authorities can do so. So that prevents misuse of that system. The TAN is provided by the hotline after a callback. So they call back the public health authority under a list of telephone numbers that they also have pre-registered for them. And then the person doing the warning, so either the public health authority person him or herself, or they give the TAN to the event owner, and then the event owner does it. They upload the information onto the backend server. Yeah, and so to finish with here, just some screenshot of what it looks like in the Corona Warn app. So that's the area where you go, that where you scan your QR code, you add that time information here, and then you add the TAN, and with that you do the warning. And through this solution, we hope we have closed the gap between the different systems, so that even when people are using one of those solutions, still everybody can get warned who had been exposed there. Thank you.
So thank you so much. And our last speaker before we open it up is James.
Hello, everyone. So I'm going to talk about Bluetooth beacons for presence tracing. The idea here, the goal here is the same, where you want to notify people who've been at a location. But the difference is that you want to automate the check-in process because a lot of the challenge with QR codes is that people may not check in, they may not check out if that's even something you want them to do. And for things like public transit, it's not feasible. So using Bluetooth devices, you can exchange the same information between the smartphones and the location. One of the nice things is that the hardware is pretty standard. So these can be like small battery powered devices, they can be plug-in devices, and there's existing uses for this type of hardware, so it's pretty cheap. And the other benefit is that this can be set up without an internet connection required for the hardware devices. And that has two benefits. One is that it's much easier to set up and cheaper. And the other is that it's much easier to sort of guarantee privacy because you're sort of building in that there isn't going to be a centralized store of this information. So there's a couple of setups where you might want to make this work. The most straightforward one is that you want your existing GAIN app to be able to work with these beacons. But the difficulty with that is that Bluetooth access is restricted, except through the OS. So one way to get around that is to basically make your beacons act as other smartphones would. So you can broadcast RPIs, or you can broadcast the data in the same format as GAIN. And then when you want to notify people, you can upload the TEKs or the keys used to broadcast that data in the same way as you would with GAIN. And the benefit, if you set this up properly, is that you can get these notifications to all people who are using a GAIN app. And there's no additional steps on the notification side. So the caveat with that is that with some of the QR models, actually all the QR models, you get a location diary on each person's phone. But in this case, you can only use it for notification. So how that would work is someone would, in contact with contact tracers, would specify a location and a time. And then the contact tracers can use a web portal to rederive all of the, so like if you have a database of the beacons with persistent keys, you can rederive the keys that they used at that exact time and place. And then you can send the exposure notifications using all of the existing GAIN infrastructure. The one benefit of that way of doing the system is that the person who was infected doesn't need to have the app. They can just notify the contact tracers about where they were. So I tested this a year ago, and it works round trip. You can get notifications on a GAIN app, just as you would. And you can use different metadata to specify that it's a beacon notification and not just a proximity notification. So then the second setup is for non-GAIN beacons. And the options are much larger here. So you can basically just consider these as devices that can share information. So you can do all of the same setups you had with the QR codes. And another option that I'm optimistic about is using existing infrastructure. So Wi-Fi routers are a main one, where if you can build a privacy preserving system into Wi-Fi routers that are already out there, you can get scale a lot faster. So in conclusion, beacons help to automate presence tracing, and by making them not internet connected, you can get the same privacy guarantees as a QR code.
So thank you to all our speakers. And before I open it up to audience questions, I want to give you, or the panelists, a chance to ask questions of one another. Well, I'll go first. Does anyone have any secondary attack rate information for any system of presence tracing, including paper-based or anything else so far? Okay, I know some places like Australia must have it.
Yeah, like not on hand, but I mean, you could probably find it. We don't. One of the things that I wish that we had is more detailed analytics of people, of whether people who've gone into the kind of contact tracing system have been alerted the first time through the app, because of course there's all of these other ways that people get alerted. And so we don't really have the kind of metrics that I'd like to see of exactly how effective it's been. I'd be curious to know if anyone else does.
Nobody yet. Okay, so I'll just reminder to the audience that you can upvote questions, but meantime, I guess I'm going to take the questions in the order. Now, Queenie, you're the one who will have to actually promote people and allow them to speak. So can you, the one upvoted one so far is Renee Peralta. Can you let Renee speak?
Okay, Renee, I've allowed you to speak.
I'm sorry, I heard my name. I'm not sure why, because I sent that question.
Yeah, that's right. You now get to ask your questions.
So the question was for the last speaker that I just wanted to know. The beacon listening is very expensive for batteries, so the phones do it not very often. So I was wondering if this is just broadcasting by the beacons, and if not, how long does the battery last?
Yeah, so the models I've been considering have been broadcast only. So in that setup, it looks a lot like a tile device would, and you could get over several years of battery, especially because you're not too constrained about the battery size or device size. So it's great because it fits into an existing use case, and industry's already solved this problem.
Sorry, I missed the first part of what you said. It came out garbled. So
sorry. I was saying that it's broadcast only.
Okay.
And you can get a big battery because you're not carrying these around.
I thought it might be. Okay, thanks.
Yep.
Okay, Andrew Chen, Queenie, can you let, I think you promoted Renee to a panelist. There's also a allow to talk button that acts a bit faster.
Good morning from the Elimination Islands. Depending on which modeling
archipelago, Andrew.
Archipelago, sorry. And I know that Luca Ferretti's here as well, and his work was pretty seminal and kicking all of this off back last year with the modeling work to show that digital contact tracing might be helpful in this pandemic. But all of the papers sort of show that a relatively high level of participation is required. We had some local modeling here that showed that it pretty much needed to be 80% participation amongst the population to be effective. So what is the best estimate of participation rate in each of the jurisdictions presenting today? And I guess, in addition to that, is there some sort of target in each of those jurisdictions? And are you close or not close to those targets?
And Luca, I think we'll let you answer that as well, on top of the others, if you want to add.
I can go first because so for the NHS app, of course, participation. So the NHS app has the QR code system integrated with the GAIN app, but to be honest, all of the QR code system was mostly to encourage participation in digital contact tracing done with GAIN. So in the UK, there was never an effective integration between the manual contact tracing and the QR codes for reasons that have to do with internal management rather than structural reasons. So the QR codes were really beneficial in our experience, not so much for the uptake. I mean, the uptake of the app was a bit between, now we are around 28% of the population. But the point was never about using these QR codes. So the uptake of the QR codes in themselves was really poor in the UK. The main role of the QR codes was in actually stimulate, since to go wherever you wanted to go, you tended to have to scan those. It was not compulsory, but typically people in Britain tend to follow rules, even if they are only advisory. So in practice, it was a good way to actually encourage the uptake of the app, though the epidemiological consequences in themselves of QR codes were negligible.
Who wants to go next? It's a big question.
Yeah, so I can easily speak to Switzerland. So we had 22% participation at the peak for the app, the GAN app. Now it's a little bit less, like it's 19 or something. And 22% participation. And then the other key metric is the yield, which is the fraction of people that were positive that entered the code. And at the peak during the second wave, which was for us still a wild type wave, it was about 15%. And there are a few explanations why it went from 22 to 15. And part of it is process and issues of integration with the public health system to generate the codes. And this is not the presence tracing. This is GAN basically itself. We do have evidence, it's not very detailed, but we do have evidence in some regions of Switzerland where we're able to correlate the impact with that of manual contact tracing. And the big takeaway is speed. Humans get overwhelmed very quickly. It's very difficult to scale an exponential to solve an exponential problem with linear resources. And the technology allows you to maintain the latency, whereas inevitably there are bottlenecks that would build up in the public health processes. We had some bottlenecks in the generation of the code, but still we were much faster than manual contact tracing. And that's typically by a day. And the big takeaway from our study is that it basically, reduces the latency of notification by about approximately 1 day. And then of course it has complementary outcomes. Some people get notified that would not be known otherwise. And then there's an overlap.
Eduard, do you also observe an extensive use of your presence tracing protocol?
So our presence tracing, you were the earlier New Zealand and then the UK that deployed their presence tracing protocol first. We had exactly the same situation that Justus described in Germany, which is there were some, in my opinion, relatively ill-written laws that were put in place very early in the pandemic for restaurants that provided a obligation for public venues to keep track of identities. And so that triggered sort of a whole wave of private-owned applications, most of them relatively poorly written. And in fact, that generated some privacy issues that our own data protection authority identified. And then our version of the presence tracing sort of came later. But the bulk of our uptake was completely independent of the presence tracing. And I don't have any data on presence tracing at this point.
I think I'll actually, James, I might take this one for WeHealth.
Sounds good.
Yeah, on Bermuda, where we're rolled out, we're probably at a similar level to France. I think it's it's good to look at active users divided by the population, but it's even better to look at codes entered versus the number of cases is a better metric. And recently, we've also been similar, around 15% on that. And of course, a much higher percentage than that of active users divided by total population, that it makes sense that there are some obstacles to code entry and that there are some non-representativeness of the people who get COVID versus the rest of the population. So those are two different numbers, and that lower number has been on the order of 15%, which we believe is definitely of an order high enough to have an effect on transmission, without necessarily being a complete pandemic stopping game changer. Higher numbers, we got, we did a very clustered rollout strategy with a focus on the University of Arizona in fall 2020. And we got that number of cases who entered codes as high as 25% there. And we also, through case investigation, looked at how many cases, not general population, reported app use, so that we get rid of the unrepresentative problem, and that was about 50%. So about half the cases, the students had the app, and about half of those entered their code afterwards and prior to the case investigation interview, very importantly, so very quickly entered the code because it was available through their test results portal. And we think that is definitely high enough to make a larger effect on disease transmission, which interestingly tanked at exactly the same time as around the time you'd expect after code issuance was automated. And so we think is sort of supportive of this thing that Luca was the first co-author of a Harvard Business Review paper very early on in the pandemic, really advocating for a clustered approach to getting people to use the technology. Anyone else want to take that question? Sorry,
Yeah,
so far all of the answers have been long to this one, Andrew.
Yeah, I can try to give our bit here as well. I think it's actually really difficult to answer this seemingly simple question, and that is because, well, first of all, you have to define what is actually an active user here. And when we were looking into that, we saw that we had quite different definitions of what an active user constitutes. And so we have in Germany, for example, we have like 34 million downloads of the app. We assume that there are slightly more than 20 million active users in that way, that they are really using that Bluetooth functionality of the app, because there are many other functionalities that are used by other users, and they may not use all functionalities of the app. Then the question is, so of those active users, would they all upload their keys when they test positive? And we see that only a bit more than half, maybe 2/3, but certainly not more than that, are actually doing that. So the others get warned. They are part of the system, but once they get positively tested themselves, they decide not to share that information with others. On the other hand, so when we talk about, let's say, 20 million active users compared to the German population, we should also not put it in the perspective of the 80 million people in total that we have. But there's, of course, a very young part of the population, so which, according to our regulations, are forbidden to use the app. So if you're under 16, you can't use it. If you take those out, if you take also those out that are very old and maybe they live in elderly care, they would probably not need that app for their daily mobility. If you take them out as well, maybe you arrive at something like 1/3 of the population, of the eligible population, so to say, relevant population using the app. That is for the proximity tracing. As I explained in the presence tracing, we have the difference from the proximity tracing that you can actually, in a way, link the different systems. So those that are using the app and those that are using other means, which is not the case for the proximity tracing, where you can't do that connection. I'm aware. So when you say that, Andrew, that in your modeling you found out that it needed 80% coverage to get a result, I'm wondering what assumptions were there. So were you looking at only using the digital contact tracing as a mean to control a pandemic, or is it an add-on to other means. And we believe, I remember also the discussion around the Oxford paper that we had early on, where they were stating a 60% coverage was needed. I think that is really based on the assumption that that is your only tool that you use. And if you see the presence and the proximity tracing as an add-on to other measures, I believe that every, and we all believe that every user, their counts, and even if you are way below the 80 or 60%, it has a clear effect on transmission chains, and it ends transmission chains.
Yeah, it wasn't my modeling, but I would agree with your conclusions there. So thank you for noting that as well. I think from a modeling perspective, you have to isolate out the individual interventions to try and measure the potential impact of those interventions. But obviously, it's not the only intervention that you would use. We have to use everything that we can.
And I would just, my own hobby horse here is, you know, we have this magic in epidemiology called the reproductive number, and not to pick on you, for Luca, for kicking it off, but a lot of the reports are focused on the number of cases averted, which, yes, Samir Halai recently had a great analogy for what that's like. It's like the number of houses saved from a wildfire. The bigger the wildfire, the more houses you get to save from it. You know, that doesn't mean more houses saved is a good thing. And so estimations in terms of the degree of reduction in RT, I think, are much more comparable across time and place than comparisons of the number of cases averted that the Nature paper seems to have kicked off as being a popular metric. Luca, do you want to respond, or Vincent? I don't know that you actually replied to
no.
Andrew. Should we try more questions? Luca does want to respond to.
I was curious to hear Vincent about this question about uptake in France, actually. Then yes, I can answer.
Yeah. Regarding French application, as I said, there are many features integrated in our TAC to Santi-COVID app. So it's a bit difficult to right now distinguish between the use of each of those features. We will know more about this because we are collecting statistics on usage statistics for those services. And in the coming weeks, I hope to have figures, more accurate figures. So right now, it's we are still in the early process of those of what statistics we have. So I cannot answer about those the weights used and the efficiency. So it's still on progress. But yet on the other side, colleagues of mine are conducting a sociological analysis of the app. The French app, not only the French app, but in particular the French app, since they are French. And we have an understanding on more qualitative manner on the weights used and the fields and the way people do interfere and use those apps, what they believe about this. And that's very complementary. I won't go into this direction because it's not my field of expertise, and I don't want to say to tell mistakes, but that's also very, very interesting as a complementary to what we can have from the technical viewpoint, and we will have a better understanding of the situation in the coming weeks. That's what I can say. But unlike Germany, I think we in France are very lucky in the sense that we only have one contact tracing system. We only have one presence tracing system, and this is the ones that we decide. Those systems are used throughout France in a homogeneous way. It's a bit different from the remote French territories, but for France, it's the case, at least.
Vincent, yeah. Is it the same map that actually contains the green pass as well?
Yes. All the features, as I said. So green pass, so at the stations, when you want to go outside and there's a curfew, for instance, all the systems are integrated in the same app. And from a privacy point of view, we can discuss about whether this is a good approach or not. But this is what I said. We make strong assumptions. We assume that we have this DPA, in our case, the CNIL, which is this authority that is in charge of auditing our systems regularly, on a regular basis, so as to make sure that there is no deviation, no wrong, well, you see what I mean. We have to keep on the same private and same privacy considerations in our app. That's the strong hypothesis. But with this hypothesis, we have, well, we are confident, and I see that people are also confident on the fact that there is no big issue from this point of view. So this matter of trust, and in our case, the presence of DPA is a key aspect for building this trust with the population. It was maybe what you suggested in your question.
I mean, I was wondering because, as I said, the main role of QRs, unfortunately, in England was actually the one to encourage uptake of the NHS app, and therefore to use more the GAN contact tracing. So I was imagining that the fact of integrating the green passes that are essentially compulsory in some parts of Europe, like Italy and essentially France, that means that this brings up the uptake and the usage by a lot, I guess.
Yes, but in our case, the uptake was not motivated essentially by this presence tracing system, since it only arrived in June this year, so 4 months ago. The uptake was more probably on the DCC, the certificate recently, and before that on additional features. Statistics, I think, are also well appreciated by the users. Attestations also very practical too. So all those features help each other to have a good uptake of the app.
So I think go ahead, Merrin.
I've got some numbers. If I know that you've already got these, Andrew, but for the benefit of others. So New Zealand has a population of 5 and a bit million. Our target population of people over 15 is 4 and a bit million. There's an optional registration step when you download the app, and we've got 3.2 million people who've registered. In the last 24 hours, 2.1 million devices have checked for Bluetooth tracing keys, and 1 and a bit million people have either scanned a QR code or manually added an entry. So there's sort of this, we go from 5 and a bit million, 4 and a bit million, 3 and a bit, 2 and a bit, 1 and a bit. Obviously the number of people who've scanned a QR code is confounded by mobility, and with Auckland in lockdown, which is our largest city, that's we would expect that there's quite a few people who just aren't going out.
I'm surprised it's as high as it is, that last one.
So the rest of the country's in level 2. So we are, no raves, but we can still go to cafes.
And we just introduced mandatory record keeping in the last couple of weeks. So sorry for asking a very long and difficult question, but thank you very much to all the panelists for your comprehensive answers.
Justus.
Yeah, thank you. I have an add-on question to you, Merrin, as you just mentioned the numbers of users who scan QR codes. How do you count that in the system, in your system?
We use Amazon Pinpoint for anonymous-ish metrics. So we've got, there's some analytics events. We've also, I think similarly to the work with your data protection agencies, we've been working quite closely with the Office of the Privacy Commissioner in New Zealand, and they've gone over all of our instrumentation and metrics collection, and it seems to be fine. So we get a indication of how many how many QR codes have been scanned, how many people have it, how many entries have been added, and there's a key that's unique to a day that that we can get an indication from. It is a little bit hard in terms of communicating the privacy aspects while we do report these numbers. So that's the challenge of having those metrics, because there is significant interest in them.
So I can just, is that like the NHS app, that it's a daily packet encrypted and uploaded to a single server, or?
It's probably less. It's not quite a daily packet. It's it is just an event.
It's an event-based system.
Yeah. I noticed that everyone else put in their GitHub links, so I'll just put those in the chat. You can have a look if you like. Yeah, so it is an event-based system, and there is, yeah, it's using Amazon Pinpoint, so it's not quite as creepy as putting something like you know, any of the creepy ad tech things in there, but it is a compromise that I don't know if all of your jurisdictions would accept. There we go.
Okay, there are always more questions, but I think we are over time by a sufficient degree. So thank you everyone for accommodating a different time. I'm very glad that we could have a different, so especially thank you all the Europeans for staying up late, and thank you to Merrin for getting up early, and we in North America get it easy in between the two of you. And that was great, you know, and for having such a productive comparative conversation between all of these options. And I hope all of your systems work, and some of them generate really cool data soon that we can discuss in the future.
Thank you for the invitation.
And again, next time in October, we have an event on what to do after people are contact traced and post-exposure prophylaxis. So I hope to see many of you there then. Probably not Merrin, given the time zone. Thank you, everyone.
Thank you very much for joining.
Bye-bye.
Yes, thank you for the invitation. Goodbye, everybody.
Thank you.